should Rhode Island be going back to remote learning after the holiday break?
I think this is something schools have to decide. We're not seeing a lot of transmission actually in the schools, but we are seeing a lot of kids, quite frankly, get COVID, but they're mostly getting it from living in the community. I think the main thing I really need every student to understand is that, one, we really want you in school because we know that's important for you. The second thing is, and I've been telling this to my patients too, you need to get the vaccine. The best way to protect yourself, but really just quite frankly, not spread the disease as much, is just, we've got to get less people infected with this. So we really need kids to get the vaccine. Our uptake on child vaccine is okay, but it's not what we need it to be. And I think one of the things I'm hearing from parents is they want to wait for more time. And quite frankly, the risk is now. In the crisis is right in front of us here. So now is the time to get your child vaccinated. If you're 5 or older, you've got to get vaccine number 1 before you can get number 2. So I'd work to get that vaccine. The sooner we get our population vaccinated, the sooner we get over this darn thing.
So I know every state is handling it differently with the same goal in mind, keep everyone safe. I know that, Washington, D.C. school districts are actually handing out rapid tests to families to take home and say, take this before you come back. What can Rhode Island do? I know that we are upping access to testing at least.
Yeah, we do have a pretty robust testing system. It's been strained though. I think one of the things you're seeing right now is the demand for testing is quite frankly ferocious, but that has a lot to do with there's just so many cases right now. We're seeing numbers in our daily, over 1,000 every day. This is some of the highest cases we've seen throughout the entire pandemic. This has a lot to do with just way too many people having this disease. And I think it really gets back to some other issues, is like, we know what works, right? In other words, we know masking was very effective. Last year, we didn't see anything last year as far as RSV or flu or other diseases. And we really did a decent job managing COVID even before we had a vaccine. But I think masking is one of the things that people just kind of forgot how important it was. As people get together for the holidays, I would definitely make sure you're masking if you're going to go to someone else's home. I think that's really imperative to do that. And I think it really gets to how just important it is to make sure you have a high quality mask. Like I wear a KN95 mask. Some people like the N95 mask, which is also good as well. But quite frankly, a surgical mask is fine too. I happen to have a black one here that matches my outfit today. But I think masking is really important wherever you're going.
So I know so much talk last year, we were waiting for the vaccine, waiting for more people to become eligible. We thought this year is going to be the catch-up year. We're going to, figure out learning loss, all of these things. It seems like, we are still in a tough spot. Do you believe we are catching up with everything? Is next year, what do you think next year could look like? At this point, I feel like we're just, who knows?
Yeah, I think it's always been team human versus team virus. As much as it's been weirder, it's always been team human versus team virus. Right now, though, team virus is winning. We were winning, but they recruited a new player. They recruited Delta, and now they recruited Omicron, and they have new players. I think what team human needs to do is look at what works for us, right? And you put all the politics aside. But if you really look at what works for us, it's masking works and vaccination works. And if we can do those 2 things and do them well, we can win and not deal with this anymore. But the thing that's been a struggle for our country, and I do mean the country, is we've had these great solutions in front of us with these vaccines, these really great advances of science. And we've had way too many people say, that's not a good enough solution for me. And quite frankly, that's the problem, is we just need more people to just say, look, I've got to get a vaccine. And we know more people to say, look, as much as you may not like wearing a mask, that's the best solution I have for you. And I think the other thing we need to just acknowledge is right now is when you see a lot of cases like this, it's probably not the best time to run around like you always do. One of the things I've noticed when I look at the world around me and I read the news, I'm hearing the word cancel. Hockey games are canceled. Other things are canceled. And I think you're seeing right now with there being so many cases, people have to reevaluate their holiday plans and say, gee, do I really want to have a big Christmas Eve gathering, a big Christmas gathering, or do I need to cancel or find a way to make it safer, which might mean make sure got some windows open, make sure everybody's vaccinated, make sure people test before they go. What can I do to make sure that if people visit my home, they visit safely? Because we're in a very challenging time right now. But quite frankly, I do think once we get beyond this variant, the Omicron variant, we might be able to get to a better space, but it's going to be a matter of just navigating this particular variant right now.
Mm-hmm. And when it comes to the future of schools in general. I know Massachusetts said, hey, you can drop the mask mandate if you get to, 80% vaccinated. Do you think Rhode Island will stay the course when it comes to all of these required precautions, masking, social distancing, all of that?
I don't think we can talk about reducing any mandates right now as far as that goes, because we're just seeing too many cases right now. I mean, when you really look at what we're seeing case counts now over 700 per 100,000 per week. And the highest case counts are in school age kids, but we don't really see that transmission in schools. It's in their homes and in their community. So it's really hard to have that conversation until we get to the other side of this. And I think it just acknowledges where we are right now is we're in a very difficult time. Every case affects our healthcare system, which is really strained quite a bit. The hospitals are very stressed right now. And I think we have to acknowledge that our healthcare system was never designed for a 2-year pandemic. And we have to just be honest with each other. Like, what can we do to be part of a solution? And part of a solution means, like, how do I not get sick with anything? So even if you're boosted like I am, I wear a mask when I'm outdoors because I don't want to get the flu. I don't want to get RSV. I don't want to get anything. And we need more people to just say, I don't want to get anything right now, because that will then put less stress on our healthcare system, which is already taxed way too much.
And my last question is, I was speaking with some school nurses yesterday, and they said because of the understandable focus on COVID, there are some things that, have fallen to the wayside, these mandated screenings, all of that. What are some things non-COVID related that parents should start thinking about to make sure that, they keep their kids in top shape in every aspect of their health?
I think a couple of things I would just say. One is, if you want to look at our overall health, one of the things the pandemic did was it made a lot of us larger, quite frankly. In other words, a lot of us gained weight during the pandemic. And I see that with all the patients I see in my practice as well. The kids got bigger. That was part of just being in our homes for a year. So I think we need to focus on nutrition, right? Let's eat real foods, fruits, vegetables, lean meats, and nuts. My rule of thumb is a farmer or fisherman gave me the food. It's a lot better for me than if a baker gave me the food. So look for real foods. Another thing is we got to get out more. We have to exercise more to get that done. And an hour a day of exercise is really something we all need to do. I think other things we do is make sure our childhood immunizations are caught up, because quite frankly, that's still a small issue for us that we aren't quite caught up with childhood immunizations. The other thing too is, like, if you haven't been to a doctor for a checkup, let's get the checkup done. Doctors' offices have infection prevention protocols in place. They're safe places. I think those are important things. If you do those 4 things, you're going to be off to a healthy 2022.